Joenja is a prescription medicine used to treat a rare genetic disease that affects the immune system, called activated phosphoinositide frequenase delta syndrome (APDS), generic name leniolisib. APDS is a type of primary immunodeficiency disorder that causes increased susceptibility to infections. Leniolisib works by inhibiting a certain cellular messenger that interferes with the normal development and function of immune cells in the body. Indications. Joenja is used to treat activated phosphoinositide frequenase delta syndrome (APDS) in adult and pediatric patients 12 years of age and older. How to use. The tablets can be taken with or without food. If you miss a dose by more than 6 hours, wait and take the next dose at the usual time. If you vomit within 1 hour after taking a dose, take another dose as soon as possible. If vomiting occurs more than 1 hour after dosing, wait and take the next dose at the usual time. The recommended dosage of Joenja in adult and pediatric patients 12 years of age and older, weighing 45 kg or greater, is 70 mg administered orally twice daily, approximately 12 hours apart, with or without food. There is no recommended dosage for patients weighing less than 45 kg. Precautions. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Joenja and certain other medicines may affect each other. Tell your healthcare provider if you are scheduled to receive an immunization vaccine. Joenja may affect how well a vaccine works. Tell your healthcare provider if you are pregnant or plan to become pregnant. Joenja may harm an unborn baby. Your healthcare provider will do a pregnancy test before you start treatment. Use effective birth control to prevent pregnancy during treatment and for 1 week after you stop treatment. Side effects. Common side effects include headache, inflammation of sinuses, eczema, dry, itchy, and inflamed skin. These are not all the possible side effects. Tell your healthcare provider about any side effects that bothers you or doesn't go away.